Hello, and welcome to our channel. Today we will discuss the topic of pregnancy and make it as easy as possible to understand the important aspects of this beautiful natural phenomenon to help the health of a mother and her child. Before we dive into this topic, don't forget to like and subscribe to our channel and press the bell icon to get notified of our latest videos. This video will help you learn these points regarding pregnancy, and we expect your feedback on how your experience was with us in the comment section. How does pregnancy affect a woman's health? Things a pregnant female needs to do, and things that she needs to avoid. The biggest myths about pregnancy. How to diagnose pregnancy. Pregnancy and mental health. Pregnancy delivery options. Pregnancy is a complicated process, and almost every female has to go through it, but the kind of care it demands has not been discussed or given to this. As a result, maternal mortality is highest, as compared to any other problem in developing countries like Pakistan, where it is the highest in the whole world. That's why we have selected this topic and will discuss issues related to this miracle of medical science. How does pregnancy affect a woman's health? Women's quality of life can be negatively impacted by pregnancy-related physical symptoms such as nausea and vomiting, epigastric reflux, shortness of breath, dizziness, back pain, and trouble sleeping. Pregnant women experienced an overall improvement in their quality of life as a result of increased physical activity. It's estimated that as many as 1 in 5 pregnant or postpartum women struggle with mental health issues. It is possible for it to occur to anyone. The most common forms of mental illness that can occur during pregnancy are anxiety and depression. About 10 to 15 out of every 100 pregnant women will develop these conditions. Things a female should do while pregnant. Eating a diet high in nutritious foods is especially important for women who are pregnant. Your baby will require nutrients in order to develop normally and robustly while still in the womb. Consume a diet rich in a variety of brightly colored fruits and vegetables, whole grains, calcium-rich foods, and low-saturated fat foods, such as typically domestically produced cooking oil. During pregnancy, taking a prenatal multivitamin on a daily basis can help ensure that you and your baby get the appropriate amounts of the essential nutrients you both need. Folic acid, iron, and calcium are all examples of these. It is strongly recommended that pregnant women receive prenatal care from a trained professional on a consistent basis. If a mother does not receive routine prenatal care, the likelihood of having a baby with a low birth weight or another complication is significantly increased. If available, consider group prenatal care. The body of a pregnant woman requires a greater amount of water than it did before the pregnancy. Aim to drink at least 8 cups of water every day. You and your baby both need between 7 and 9 hours of sleep every night. It is recommended that you sleep on your left side to promote healthy blood flow. Eliminating stress is one of the most important steps in improving birth outcomes. Women who are pregnant should do their best to steer clear of stressful situations whenever possible. In order to better manage the stress in your life, enlist the assistance of the people you care about. If you are choosing to become pregnant at a time when you know that you're at your healthiest, that increases your chances of having a healthy pregnancy and a healthy birth, says Dr. Meadows. Things pregnant females shouldn't do. Don't do smoking, as children who are born to mothers who do not smoke during pregnancy are less likely to have an underweight baby and are at a lower risk of developing learning disabilities. This is in comparison to children who are born to mothers who smoke during pregnancy. An interesting fact is that because of the physiological dependence on nicotine, children who are born to mothers who smoke have a greater risk of trying smoking at a younger age and of becoming regular smokers at an earlier age. Don't drink alcohol, or consuming alcohol can have a significant effect on the growth of your baby. Women who consume alcohol while they are pregnant risk giving birth to a child who will have fetal alcohol syndrome (FAS), which can cause irreversible brain damage and other major issues for the baby. At no time should raw meat be consumed. Meat and eggs that have not been fully cooked or that are still pink in the middle pose a threat of foodborne illness and cause some lethal infections to babies. Poisoning from the food is another possibility. Consume no dairy products that have not been pasteurized. Calcium is essential for the development of babies, but mothers need to be cautious about the ways in which they obtain calcium from dairy products. It is not recommended to drink raw milk because it is not pasteurized. It is a reliable source for women who are pregnant. This indicates that the bacteria that could make you sick have not been killed by heating the product. Do not spend any time in a sauna or hot tub. Even though they are very relaxing, hot tubs, saunas, and jacuzzis pose a risk to expectant mothers because of the high temperatures that are present in these environments. Soaking in hot water can cause one's body temperature to rise, which can lead to a number of complications for the unborn child. Avoid activities such as diving and contact sports. A contact sport is the one where you are supposed to be making contact with your opponent. Apart from that, continuing with most forms of exercise while pregnant is both safe and healthy. Always keep a record of your pregnancy with you. You will need this when you need to go to the maternity unit, especially when you only have a short amount of notice. This is especially important. Long-distance travel, defined as more than 4 hours, is associated with an increased likelihood of developing deep vein thrombosis, DVT, or other types of blood clots. To avoid this, try to wearing compression or support stockings, which can be purchased at pharmacies or airports, will help reduce leg swelling. These stockings are available everywhere. Be sure to consume a lot of water. Try to be active physically. You should not sit still. The biggest myths about pregnancy. Here are some interesting facts that you need to avoid as a pregnant lady because they are only going to make this process more difficult for you. Like your kid may become allergic to dairy and peanuts if you consume them. Nope, you can eat it until you yourself are allergic to it. It is believed that there are other methods apart from blood tests and ultrasounds that can determine whether a baby is a boy or a girl. But no, you can only determine a baby's sex with the use of a blood test or an ultrasound after 10 weeks. While I'm pregnant, I should eat for 2? Not exactly. You only have to take care of what you are eating is healthy and you just eat normal. Only in the mornings can morning sickness occur. This is another myth. In reality, this is basically a result of hormonal changes. Morning sickness, which is essentially nausea and/or vomiting, can happen at any hour of the day. Hanging laundry outside is dangerous. In reality, it's safe to reach up over your head and hang laundry from a line. Cream can aid in preventing stretch marks. The truth is that stretch marks, which typically dissolve with time, cannot be removed or prevented by lotions or oils. How does pregnancy affect mental health? Some women may have mental health problems, including anxiety and sadness, as a result of the physical, social, and emotional changes that occurred during pregnancy. With the proper support, most people with mental health disorders will recover. However, more recent studies indicate that a mother's mental health during pregnancy can impact her unborn child. Pregnancy delivery options. Number 1. Includes natural, unassisted childbirth, which we call normal vaginal delivery. Number 2. Then there's the assisted childbirth, which is another vaginal delivery, but this time with the help of a professional or some experienced staff. Number 3. And then there is the delivery by cesarean section. Home birth, birth centers, and hospitals are all possible places to give birth. If the mother and partner learn breathing techniques and other strategies in a birthing class, vaginal births without medication can be less painful and smoother. To choose the best delivery method for the mother, the risks and advantages of each one must be weighed against the mother's preferences. Excellent care facilities are needed for. That's all for now. In the next video, we'll cover another important topic related to your or your loved one's health. So if you enjoyed our video, don't forget to like, subscribe, and click the bell icon to be notified when we post new videos.